Okay, so the first question I got for you is just basically how do you define your evidence-based practice?
Uh, well, basically, just by researching anything through the magazines that we get in the mail,
Hmm.
different internet web-based engines, any kind of thing that I'll get through the mail or through my employees or work, or whatever.
Okay.
But just staying on top of the most current stuff.
Okay. All right. Next question I got for you. How do you, in your current practice in the athletic training room, how do you utilize the stuff that you take from those magazines, and how do you incorporate that into your practice?
Uh, well, sometimes what I'll do is I'll read what I read in my magazines. I like to practice on myself or on somebody of like one of my coworkers or something like that, kind of to figure out what's going on, what they're talking about. Maybe it's hand placement, maybe it's just the general idea of the whole system they're putting out there or whatever, or the technique. And then if I see some feedback or I get feedback from my coworkers or whatever, I will then use it on one of my athletes. Obviously, it's got to be something safe and effective. But then I'll use it on my athletes and get their feedback and see if they actually do, feel something positive from it
Hmm.
or not.
So, based on your previous education, do you feel like you're pretty well prepared to enter the force with a good backing with evidence-based practice, or do you kind of feel like you've had to pick it up through the years, reading magazines and stuff like that?
You mean like through my background and my education, like my foundation?
Yeah, like undergrad and graduate school, or
Yeah, I do. I feel like they've given me a good foundation to not only understand what I'm reading from the magazines, but then also to interpret what's good from bad, so to
right,
speak.
right. At BC, do you guys use as far as the staff members, do you guys use it quite a bit, or is there some people that kind of stray away from using evidence-based practice and use more of what they anecdotal evidence?
Um, I think we're very open to both ways.
Hmm.
I don't. I see people. I say it's pretty equal.
Okay,
Pretty equal, yeah.
cool. Um, so basically, like the three components of evidence-based practice are, like you said, the current evidence, and then your current clinical expertise, and then the patient values. Do you feel like you yourself use one of those components more one or the other, or do you feel like you use them pretty equally?
I think I use them pretty equally. Obviously, I think my values of how I interpret things are important, but also I think what's more important is how the patient, the feedback that I get from the patient too.
Right.
If they're not feeling it, or if they're not, we're not progressing with that, then I'll just simply stop that or think of another way of doing something to
Hmm.
help them.
Right. Right. So, as a profession, do you feel like we do a good job of using evidence-based practice, or do you kind of feel like we lack in certain areas?
I think overall we do a good job. I think we're constantly going to, different symposiums, conferences, whatnot, and we're picking up all these new research type articles, research type techniques, evaluations, what have you. And I think we're constantly trying to stay on top of, the most modern day healthcare. I
Right.
mean, I see that. I see that constantly year to year.
Hmm. So, do you find yourself maybe sometimes not using evidence-based practice that maybe not backed by the current literature? Like I know for myself, I like to use myofascial decompression where the evidence really isn't there, but patient values and my clinical expertise, I do see it work on patients, and I like to use it, even though it doesn't have that clinical backing. Do you find yourself that you use some of those techniques, and how do you justify it, I guess?
Yeah, I agree. I agree with that. I think I think how you justify it is just through years of success
Hmm.
and like you said, the patient's feedback on how things work,
Right.
and how they feel after, and how it helps them to maybe recover a little quicker than they thought they would.
Hmm.
So I think you can use your evidence based. I think evidence based practice is great. great concept, and I think it does work. But I think you have to incorporate with hands-on, hands-on experience, your knowledge for what you're doing, and then I think overall it's going to, the combination of the two, I think will get you in the right direction. Right. But there's certainly some more times where I think just based on your experience, you just know in the back of your mind, I've done this enough where I know this is going to work, and you kind of go that way.
Mm-hmm. So the last question I got for you, in your clinical setting, have you ever witnessed some of your colleagues maybe not using evidence-based practice where the evidence just doesn't really back it? And how do you deal with that? Do you confront them? Do you kind of learn from them and see why they like to use it? And do you maybe employ some of those techniques yourself?
Yeah, I think if I ever came across that, I would certainly ask them, what they're doing and why they're doing it. And maybe it's something maybe it's something they know that I don't know already. So I'm certainly I'm always open for learning new things. However, if I feel like it's something that maybe, not backed or something that might be old school, so to speak, we do teaching moments, and I never do anything in front of an athlete. I always do it after we'll kind of go over what we've done, what we're doing, and see if there's other ways to correct it or make it better.
Okay.